I am here with Dr. Bazan. I call him Don Juan Bazan, but nobody else gets to. With Dr. Bazan, he is a chiropractor, but am I saying this right? But he went into more schooling to go into Airrosti. And with Airrosti, they just work your muscles and they figure out your sore spots. Am I saying that right?
That's pretty
Good?
close,
Yeah? They figure out your sore spots. They work their voodoo, which isn't voodoo, but that's what we like to call it. And they take care of the muscles, and you go and visit them a few times, just like you would the chiropractor, and your muscles get worked out. So right now he's working on my hamstring and my butt and trying to figure out, I have a really hard time without getting pain on booty day, which was today. And so he's trying to work out what the deal is, and he's finding some muscles that I can pronounce in my butt and my hamstring that's causing the issues. So I want to tell you all to take care of whatever issue that's causing it. So a lot of times, usually when you deal with a injury, it's not where the pain isn't necessarily maybe what's causing it. And so, but there's so many muscles there that are tied in with each other that are going to cause the problem. So get to the doctor, get seen. Do not let your injuries keep staying and then keep working against it, because you're not doing anything but prolonging the injury and making it so you don't get the maximal benefits of each booty day or shoulder day, workout day, whatever day. Bend it and straighten it. Oh, let's floss it.
Now, I want you to rotate your hip out and in, nice and slowly, about 7 times.
Okay, so we just worked my medial glute. That was tight. And what else did you work? What big muscles?
Hamstrings, quadratus femoris, glute maximus, glute medius, and now we're getting into your lumbar extensors, quadratus lumborum.
Gotcha. So with afterwards, some of my exercises, I watch my form really well, but a lot of times this is seriously so tied into so many muscles that it affects more than you think. So now we're going on my back. We already worked the hamstring and the buttocks, and now we're working the back.
So you got fibers from your glute max that come down and then end up turning into your IT band coming down this way. Then up underneath there, you've got your lateral hamstring tendons kind of coming up in here. Got a little bit of the deep lateral quad up through there, and then this is the quadratus femoris that I was talking about right here. So going from the ischial tuberosity over to your hip. So these, I think this is probably one of the main parts of the issue. So this, when it contracts, it rotates the hip. So you may not have one of your other hip rotators, one of your other deep glute muscles that's kicking in properly, and so this one's just getting overloaded. And that's right where this hamstring kind of comes up under here too. So, and it attaches right in there. So they're sharing an attachment point. Like you said, you felt the tension and pull all the way down that lateral hamstring. So we're going to work, everything in this area in the exercise room, but mostly high hamstring, quadratus femoris, and some glute max.
Okay.
All right?
Cool.
Imagine your glute here, hamstrings are here. So we're going to roll around like in a C.
Okay.
Around that, and also around like a little bit to the side. So
Okay.
I like to start the...
So we're going to floss it.
Mm-hmm.
Okay.
There you go.
He flossed my leg earlier.
Yeah. So you feel how when you extend your leg, how it deepens the lacrosse ball or the pressure that it's putting on there. So that'll help to work into that muscle really good without just overdoing it, just really hard. So it's nice, slow movement.
And do I want to be rolling it, I guess, or just stick
No,
that point?
just stick on that point and then just move the leg back and forth. And what that does is just it applies pressure and then backs off, applies pressure and backs off. Okay. And kind of, so it gets right on the point, and then it also gets kind of the surrounding tissue by moving the muscle just slightly.
Gotcha.
And so we'll spend about 2 minutes doing this. We're already a minute in.
Okay.
So luckily with all the videoing, I can see exactly how long we're doing.
There you go.
So.
Yeah, so we're just a lacrosse ball and something hard.
Right, so a dining room table, a hard chair, any of it works. And then also you can move it around. So you can move your lacrosse ball around and, you know, do it a little bit to the side or a little bit elsewhere so that we really hit all the tissues.
So just stick in one place when you're doing it, but then once you feel like you're done in that area, then move,
so if you,
then read.
Right, so if you feel a release, then you can move on to the next point. So it's a really good idea to maybe roll, if you're using a foam roller, roll with a foam roller. If we find something that needs a little extra attention, that's when we can go to the lacrosse ball.
Okay.
Or the reason we do lacrosse ball with the high hamstring issue is because it's really hard to give it the attention it needs with the foam roller.
Right.
There you go, deep lunge, both hands in. And then if you want to deepen, drop the inside elbow to the heel. There you go. And we'll hold this for 45 seconds.
Okay.
So this one's kind of a long stretch.
Yes.
So when
and you can feel it.
Yeah.
But it's good because it's getting that tightness, and then it's also helping this hip flexor
right.
as well.
So that's a really good stretch. And the reason we stretch so long, our ideal stretch is a 90-second stretch. Oh. So time under tension actually gives you a better stretch than doing it repeatedly.
Okay.
So, but we break it down into like 2 sets of 45 rather than, hey, let's just hang out here for half of the session.
Okay.
So, and we like to build up to it. Okay, so you're switch.
Goodness sakes.
It's a really good one, right?
Yeah.
I'll get you on the side too so you can see what it looks like from the side.
It feels good at first, but the longer I see it, the more like, woo! But it's a good one. I know it's a good one.
Yeah, it's a really good stretch. So,
this is definitely one that people should be doing daily.
Yeah. So this is one, I have hip flexor issues. So you can use it for hamstrings, you can use it for hip flexors, adductors, people that have adductor issues, it's really good for them as well. So, and then this one will also be twice a day. So we're going to do 2 45 seconds stretches per side twice a day.
Okay.
So you're getting that 90 seconds in, we're just breaking it up into 2. So you can go ahead and relax.
Oh, my.
One.
Okay.
So this one's an internal rotation stretch, and then the next one will be an external rotation stretch, which is the exact same thing, except we're going to turn our toes outside instead of inside.
Gotcha.
So we're going to do 30 seconds each, and then we're going to do both sides as well. But do you feel how nice and deep that is?
Yeah, I can feel it clear into here.
Yeah, Dr. Bazan made this up, and it's so awesome.
Wow, that's
so
awesome.
He makes up some really good ones.
That's great. He's a good one.
He really is.
Oh, am I supposed to have my elbows down?
Yeah.
Unless
it's too deep. If it's too deep, you can come up a little bit. So,
I have such long legs.
Yeah. And also, like if you're on a table or something, it'll be different. Or using your bed, just depends on the height of what you're using. Yeah. So, all right, let's go ahead and externally rotate.
Okay.
Step back again. There you go, and then shift back into it. There you go. Good.
Oh wow. That's so different.
You can feel how it comes to gets the other side of the hand.
Yeah.
So.
Oh, I hear rain.
Yeah. So
that's so crazy. I mean, you're pretty much standing here.
And then just shift back. And then it gives it a nice deep stretch. So, but the hamstrings you have 4. So we want to stretch all of them.
Right.
And doing this internal and external rotation allows you to get the inner and outer muscles. All right, let's go ahead and do the other leg.
I just got my exercises done. This is one thing I love about Airrosti. Here is the name right here. Because not only do they work out what is bothering you, but you also get to learn more exercises. And that's where I've gotten a ton of my education, is from what I have learned in Airrosti and the appointments here. So best experience ever. Try and check out if you have Airrosti. There's only a specific, do you remember what states have Airrosti?
So we have Texas, Ohio, Washington State has a few, and Virginia.
So Texas, Ohio, Washington State, and Virginia has Airrosti. Try and see if you can find something like that. Look for that logo, and maybe one day you'll get lucky. Or if you go on vacation, come find one. This got taped up. How come I feel cool when I get to wear the rock tape? Like, I feel like a bad A girl. So we got the rock tape sporting. Got some Airrosti rock tape going here. It really just brings it doesn't, rock tape or the tape brings the blood flow back to the area to try and heal it. Correct? Am I right?
Mm-hmm. Yeah.
Yeah. So that's why we do it, and it's cool. So go get you some rock tape and get you taken care of. Get your health put first, and don't keep blowing off the injuries. Have a good one.